How do doctors find prostate cancer before symptoms appear? Let's unpack the detective work behind cancer screening and why it can be a true lifesaver. First, the PSA blood test. PSA stands for Prostate-Specific Antigen, a protein made by the prostate. It's an enzyme, and PSA is produced by prostate luminal epithelial cells and hence is present in both benign and malignant prostate conditions. PSA is most predominant in seminal fluid, and its primary function is to liquefy gel forming proteins produced by the seminal vesicle, such as seminogelin, after ejaculation to facilitate sperm to travel in the female reproductive tract. Therefore, prostate infection, urethral catheterization, prostate massage, urinary retention, prostate trauma, needle biopsy, and sometimes ejaculation can lead to elevations in serum PSA. If your PSA is raised, doctors will do more tests to figure out what's really going on. Advanced biomarkers. To improve screening specificity and detection of prostate cancer, several derivatives and specialized tests are used. PSA density, calculated by dividing total serum PSA by prostate volume. Lower PSA density suggests a low chance of prostate cancer. Free PSA, a lower percentage of free PSA, total PSA, is associated with prostate cancer. Prostate Health Index (PHI), a computed biomarker based on pro-PSA, free PSA, and total PSA, outperforming free PSA and total PSA for the detection of castration-sensitive prostate cancer. The PHI is FDA approved. 4K score, a blood-based biomarker incorporating total PSA, free PSA, HK2 and intact PSA, which predicts the probability of finding a Gleason score of 7 or more disease. Urine-based biomarkers. PCA3, a long non-coding RNA, is highly specific and independent of prostate size. The My-Prostate Score assay combines urinary TMPRSS2 ERG genetic fusion and PCA3 with serum PSA to predict aggressive cancer. I know these are a bit complicated, but they are necessary early indicators that avoid unnecessary biopsies. Digital Rectal Exam. Don't be fooled by the name. No high-tech electronics are used in a digital rectal exam. For this test, the word digital means finger. The doctor will insert a finger into your rectum to feel your prostate for any signs of cancer. The doctor will wear gloves and use a lubricant to make it easier. A digital rectal exam, also called a prostate exam, may be an awkward and unpleasant form of testing, but it's the simplest and most direct way to check the size and texture of your prostate. An irregular or hardened part of the prostate could be a sign of a tumor. Not all parts of the prostate can be felt during a digital rectal exam though, so it's usually paired with a PSA test and other factors, your age, race, family history, and more, to determine whether you need further testing. Imaging tests. Multiparametric MRI. MP-MRI examinations typically include 3 sequences: T2 weighted imaging, diffusion weighted imaging, and dynamic contrast enhancement (DCE) imaging. In general, it is strongly recommended that MP-MRI be performed on a 3 Tesla magnetic strength MRI scanner. If a lower strength 1.5 Tesla MRI is required for a patient because of an indwelling medical device like a stent or orthopedic implants, incompatibility with 3 Tesla MRI with an endorectal coil (ERC) is a recommended procedure, which itself is difficult and unpleasant for patients. So moreover, there may not be a significant difference in image interpretation between a 1.5 Tesla with ERC and a 3 Tesla without ERC. There are three main reasons to do multiparametric MRI. Firstly, MP-MRI has been incorporated into MRI truss, a kind of biopsy technique which has led to an increase in the diagnosis of high-grade cancers with fewer biopsy cores, while reducing the detection of low-grade and insignificant cancers. Second, MP-MRI aids in better assessment of extracapsular outside prostate extension, T-staging. Third, MP-MRI is equivalent to CT scan for staging of pelvic lymph nodes. Ultimately, MP-MRI outperforms bone scan and targeted X-rays for the detection of bone metastasis. Other imaging techniques are Transrectal Ultrasound, uses sound waves for a detailed view, often guides biopsy needles to the right spot. CT scan checks for spread to lymph nodes or other organs. PET imaging. At this time, the NCCN guidelines only recommend 2 PSMA tracers. The currently FDA approved PSMA agents F18, piflufolastat and gallium-68 PSMA 11. PET-CT or PET-MRI can be considered as an alternative to standard imaging of bone and soft tissue for initial staging, the detection of biochemically recurrent disease, and as a workup for progression with bone scan plus CT or MRI for the evaluation of bone, pelvis, and abdomen. In our next episode, we'll dive deep into the world of prostate biopsy. When is it truly needed, and when can you safely wait or watch instead? You won't want to miss it, right? Thank you for watching, sharing, and looking after your health and the health of those you love. Stay curious, stay proactive, and see you soon for answers you can trust.